So, my name is Varshni Nair, and I am a counseling psychologist at TalktoAngel. And
Mhm.
today is National Cancer Awareness Month Day on 7th November. So, we at TalktoAngel, we are taking this initiative to raise more awareness about the mental health aspect of cancer that the cancer diagnosis has on the patient and their family. And today we have Dr. Suchitra Mehta, and a psycho-oncologist, to discuss and share their experience on this topic today. Right. So welcome, Dr. Suchitra.
Thank you.
So there are, like, as we would like to bring more awareness. So uh, in as per your experience, what do you think, like, what are the challenges that a cancer patient faces when they like get the diagnosis of that they are dealing with cancer here?
In this century too, we talk about cancer awareness, and we understand that many people, many patients, they are aware about cancer diagnosis and cancer treatment. But still, when they hear the diagnosis for the first time, there is always a question like, why me?
Right.
So, whether the patient is educated or non-educated, illiterate, rich or poor, doesn't matter. But the first question comes to their mind is, why me? So, there is first denial,
Right.
like they are not ready to accept, and then slowly they start accepting, and then the process starts, like they get sad and then depressed, and there is anxiety about the diagnosis, about the treatment, and then what will happen next. So all these emotional issues and journey, the patient goes right from the diagnosis till end of the treatment.
Right, right.
Yeah.
And apart from, like you said, they face a lot of stress in this process, and the gradual process of accepting their own diagnosis. And what about their family? Like, when they have to see their loved ones go through this arduous journey of this whole thing of going to chemo and everything. What How does their mental health get affected in this?
Actually, this is a very vast thing. I would like to tell you that many times it is thought that cancer diagnosis and then treatment and management is just the work of cancer specialist. But it's not like that. It needs a holistic approach. Like we need to understand what is going on in patient's mind, as well as what are the emotional things or psychosocial issues of the family as such. Or if the family is not there, then caregiver. So first is, as I told you, that there is denial. So what we do, that we make the patient understand that yes, let us accept that this is happening, and then let us talk about how to go ahead. Like there are ways to go ahead. It's not end of the journey, like it was thought before that cancer is like death sentence. It's not, it's no longer like that. We have so many options, we have so many treatments available. And even though cancer, we do see cancer in 4 stages, and we understand that we can treat cancer well in stage 1 and stage 2, and we can't give good quality of life in stage 3 and stage 4. But still, when patient comes to us in stage 4, we have many options for patient to offer, and it's not end of the life, and we can give good quality of life. We have good options for that. So, with the patient, we always counsel family because they also need to understand what is going on in patient's mind and what are the needs of patient.
Right. So you psychoeducate them, you sensitize them about the whole process, as well as the toll that it takes, like to see them go through it, and the caregiver burden that they also experience, the helplessness they might also experience in this process. Do we give them any other support resources in which they can also deal with their loved one's diagnosis?
Uh, like from diagnosis, yes, there are various things like there are various issues. So what we do in a psychosocial assessment, we take a distress score. We call it as distress thermometer. So distress is labeled as sixth vital sign uh, in cancer care. So according to that, we score the patient. We see how much is the distress. Distress could be because of anything, not only because of cancer, but there are so many other related issues which can cause distress. So according to that, if it is mild, we just do preliminary counseling. If it is moderate, like from 5 to 10 onwards, then we intervene and we manage them accordingly. Like many patients, they have issues related to their physical complaints, like many have pain or vomiting or any other, I mean, like physical complaints. And few patients might have just logistic complaints or family issues or financial issues. So according to that, we I mean, problem solving management is undertaken.
Right, right. So what I'm able to understand is that with this diagnosis, many of the underlying issues they are exacerbated, and that takes a lot of more toll on the patient and their mental health as well. And like you said, that the process in which we are continuously giving them hope, and we are motivating them to go from one session to the other. And apart from just motivating them, what else? How else do we keep them going on, like till that process ends?
So, first, I told you is the acceptance. Once the patient accepts that, yes, I have to go through this, and this is the way. I mean, I can have I have something ahead. Like it's not the end of the journey. So that needs to be accepted by the patient first, and then we generally talk about the quality of life. Like for motivating the patient to undergo the treatment and further management, we always um, uh, we always talk about the quality of life, because if they get convinced that yes, they can lead good quality of life after the treatment, after cancer treatment, then yes, they accept it well and the compliance is very good. Telling them the truth and discussing about the diagnosis, discussing about the prognosis is very, very important. Because in India, many patients, relatives, they come to us and they say that, madam, please don't tell diagnosis to her, or don't tell about the prognosis. So here I would like to say that internationally it has been researched and found out that when we talk freely about the diagnosis and treatment and prognosis, then the compliance is good. See, every person has a right to know about what is going on in their body. So it is always better if the patient is very literate and is not ready to accept or ready to listen, then it is different. We don't reveal. I mean, we don't forcefully reveal the diagnosis, but most of the cases, it is better to reveal the diagnosis and talk about the treatment.
Right. Right. So they feel more assured and they know what's coming in that.
Correct. Correct.
Right. Right. And could you like provide some of the like successful examples in which you saw that working on their mental health of the patient and the family, that it brought about a very good output on their journey as well on this treatment modality.
So every patient comes for counseling. In India, awareness regarding the mental issues or mental health is not there. Even in cancer, they don't feel like going to a counselor for this
Right.
counseling session. So whenever the patient comes, we do counseling, and it happens that few patients, like young women, who are planned. I mean, if the surgery is planned for total mastectomy, like removal of total breast,
Right.
and the patient is very young and she is not ready for that. So that time it is a tough job for a counselor to tell everything, because many times patient, they don't feel comfortable to discuss everything with the clinician,
Right.
like the surgeon. So they can discuss all the clinical things, medical things, but other aspects are also there, like psychological issues, emotional issues, body image issues,
Right.
sexual issues. So all these issues can be discussed and told, can be explained in a proper way to the patient. So few patients I can remember that she was not ready at all. She was very young, hardly 32 years old, and she was breastfeeding, and in that she developed breast cancer, and nobody could guess that it could be cancer, because that is in that period, generally they get milk glands, like दूध की गिठान जिसको बोलते हैं, like she was not ready for that, and surgeon asked to remove the whole breast because it was quite large. So it was tough time to convince her. She took almost 2 days, and she kept on coming and talking back and forth, and then finally she was convinced. But it takes time sometimes. But counseling is very helpful, and it is in fact necessary in such case. And another case I remember, cancer of tongue. He was a teacher, and doctor advised him to do the hemiglossectomy. Hemiglossectomy means removal. I mean, cutting the tongue in half. I mean, half of the tongue needs to be excised. So he was naturally worried about his profession, because he was also young, working, and a teacher. So it was very difficult for everyone to convince him that why it is necessary, and you can get back to normal eventually, and you can do your job. So counseling and holistic approach, yes, it helps a lot.
Right, I understand. And like when a patient is very much attached to their body in that manner, that if like how it also goes in chemo when they lose their hair and everything, and it takes a lot of toll, especially on women who are young and very much attached to how they look with the hair, and it's very hard to let go as well and see it go, like feeling helpless in that process as well.
Mhm.
Right, right. And so, like you talked about that, the clinician may not be as equipped with their emotional state and how it could fluctuate because of the how the prognosis is or how the. So, do you like do anything to sensitize the professionals there, like the oncologist, who can better take care of the patient and their treatment in this manner?
So the best part I feel is to do research because ours is a big corporate hospital. So, and as I told you, that it is in the system. That psychoanalysis, psychosocial screening is in the system. So each and every patient is directed for psychosocial assessment and then counseling. But yes, what we do that we do lot of research, and specifically we do lot of randomized control trials, and we involve all the clinicians in that. And basic research is done by psycho-oncology department, but we involve all the clinicians in that. And like we have done research in breast cancer, so we involve breast cancer surgeons, and then medical oncologists. And if we are doing research in patients undergoing radiotherapy, then we involve the radiotherapist. So, like that, they are aware that yes, something is some help is required, some help is offered from psych-oncology department. And to quote few things, I would like to tell you that we have done almost 10 to 15 such trials,
Okay.
and we have presented our work in various international conferences of Psycho-Oncology Society, and it has shown good results.
Right, right. That's great. Could you share like one of the insight from the researchers that this was something that you found and it was very interesting to see.
Yeah, so in our psycho-oncology department, we have psycho-oncologists, then counselors, social workers, yoga therapist, a dietitian, and a physiotherapist. So it is all holistic approach. And one recent study which was published in International Psycho-Oncology Society and in the conference was on breast cancer patients undergoing chemotherapy. So in chemotherapy, what happens that they get lot of fatigue.
Right,
They are tired because of treatment as such, because of the side effects of the treatment, because of cancer, and there is overall fatigue, not related to other things like not all patients they get anemia and low blood counts, but this is known as cancer related fatigue, CRF.
right,
So in that we did we combined four therapies in which we did counseling, and then we asked them to do mild to moderate exercise, and very mild exercise, and then there was mindfulness, and there was a protein rich diet.
okay,
And after 3 weeks we again reassessed their fatigue level. So in that, we found out that there was drastic changes in the fatigue level. So that thing was published. That paper was published in international conference.
right, right. That's great. That's great to know that making such changes in their diet and to support them and their body in this manner, it like has a change and it's very effective to do so. Thank you so much for doing this research and like continuing the process that you are like making a lot of changes in this field as well. Like how you said that it's still evolving, and even though there's a lot of mental like stigma around seeking support for their mental health, and there's a lot of work to be done in this field as well, but we are like making slow progress here, so that's good to know. Right.
Correct.
Thank you so much for joining today, and thank you so much for sharing your experience.
Thank you. Thank you very much.